Alright guys, so we're quickly trying to look at the different types of diarrhea. Okay, so these different types of diarrhea are the acute diarrhea. When you say diarrhea is acute, when you say that diarrhea is chronic, you say that diarrhea is persistent. Okay, so probably some of you guys have known these terminologies, but you have not really known how to rearrange them. Do you understand? You have not known how to rearrange them all this while. So let's try to see how we can be able to arrange this concept and make sense out of it. So we are looking at the differences between acute, chronic, persistent diarrhea types. So for these differences between acute, chronic, persistent diarrhea types, see, diarrhea could be acute, could be persistent, could be chronic. We'll first of all look at the acute one, look at the chronic one, look at the persistent one. Alright, so going back to look at the first one is what is known as what? Acute diarrhea. Acute diarrhea. Okay, so for the acute diarrhea, this one lasts less than what? 14 days. Common causes is usually infections, so infections from bacteria, infections from virus, infections from parasites. Okay, food poisoning, medications like what? Antibiotics, acute stress or anxiety. All right, see, what is the symptoms of acute diarrhea? So there'll be frequent watery stools, frequent watery stools, I was trying to say something. Frequent watery stools. Okay, there's abdominal pain, there's cramps, there's fever, there's nausea, there's vomiting. Management said that was generally self-limiting, so sometimes can go away on its own. But sometimes if you want to treat, you can actually focus on what? Dietary adjustment. As the person is losing out fluid, you are trying to replace the fluid, alright, rehydration. And in some cases, you can give medications like antidiarrheal agents or antibiotics if a bacterial infection is what identified. Chronic diarrhea now, this one is more than what? 4 weeks. Well, it's actually 2 weeks. Right? Anything more than the 2 weeks, anything more than the 14 days is chronic already. Causes could be what? Irritable bowel disease, inflammatory bowel disease, celiac diseases, chronic infections, malabsorption syndromes, and all of that. Symptoms is persistent, like chronic, it has been there for a very long time, so it's persistent, you get. There's persistent, frequent loose stools, weight loss, fatigue, malnutrition, and other systemic symptoms. Management requires what? Investigation, because you want to identify the underlying cause. Then treat focus on what? The specific thing that is causing this chronic diarrhea. The persistent diarrhea is duration lasts between what? 2 to 4 weeks. Common causes is what? Prolonged infections, post post-infectious diarrhea. Okay, and what again? Early presentation of chronic conditions like inflammatory bowel disease. Symptoms, okay. Have we spoken about this? Persistent diarrhea, I think it's 2 to 4 weeks. Common causes prolonged infections, post-infectious diarrhea, early presentation of some chronic conditions. Symptoms is similar to acute diarrhea, but it's lasting longer. Alright. So you'll be losing fluid, you'll be dehydrated, and you'll be losing weight. Okay. So all of this is basically the treatments is like try to handle the underlying cause and you'll be fine. Alright.